Hi, my name is Jessica, and I'll be discussing about borderline personality disorder. Borderline personality disorder is a pervasive pattern of emotional dysregulation, impulsiveness, unstable sense of identity, and difficult interpersonal relationships. According to several studies, the onset of the borderline personality disorder it depends on the combination between genetic and environmental factors, in particular between biological vulnerabilities and the exposure to traumatic experiences during childhood. Now, there have been several studies that have shown that a diagnosis of BPD is associated with child abuse and neglect more than any other personality disorders, with a range between 30 and 90% in BPD patients. Now, for women, they account for at least 70% of patients with this disorder in clinical settings. And the most common age at first presentation is in late adolescence. So how is BPD diagnosed? Some diagnostic features. The diagnosis is based on symptoms that have been present since adolescence or early adulthood and appear in multiple contexts. And there are no actual laboratory or imaging tests that can be used to help with diagnosis. But there is a number of structured and semi-structured interviews that consist in making that diagnosis. An example of a structured interview is the diagnostic interview of borderlines. And this is a validated and frequently used tool that is generally considered the gold standard. So it is proven to be very effective. It can take at least 30 to 60 minutes to administer. Symptoms in borderline personality disorder occur in at least 4 domains: affectivity, interpersonal, functioning, impulse control, and cognitive. The diagnosis requires that at least 5 of the 9 specific criteria has to be met. Some of the diagnostic criteria, actually all of the diagnostic criteria is listed to the right of the PowerPoint. The first one is frantic efforts to avoid real or imagined abandonment, a pattern of unstable and intense interpersonal relationships. Third one is identity disturbance, impulsivity in at least 2 areas that are potentially self-damaging, for example, like spending, sex, substance abuse, reckless driving, binge eating. There's recurrent suicidal behavior gestures, threats, or self-mutilating behavior. There's affective instability due to a marked reactivity of mood. There's chronic feelings of emptiness. There's inappropriate intense anger or difficulty controlling anger. And lastly, there's stress-related paranoid ideation with severe dissociative symptoms. Again, in order for it to be a BPD diagnosis, there has to at least be 5 of the 9 specific criteria that was listed. Now, there are some challenges in making the diagnosis. The reason for that is because borderline personality disorder allow for at least 256 different combinations of symptoms that can lead to a diagnosis. For example, BPD has a lot of overlapping symptoms, and some of that, their symptoms overlap with major depressive disorder, with bipolar disorder, and post-traumatic stress disorder. Although there is a clear distinction between all of them, it can be confused with borderline personality disorder. Now, some key factors to help clinicians decide whether further assessment for the disorder is necessary is if the difficulties have been long-standing or for adolescents present for at least 1 year. And also if they're having difficulties in multiple areas. And if there is a sudden change in functioning or there's a new symptom that arises as you're working with a client and trying to decide if they have borderline personality disorder, but if they're just, again, a sudden change in functioning or there's new symptoms, then more likely it's not going to be borderline personality disorder. And that is according to the DSM-5 definition. Now, for some treatments for BPD. Now, psychotherapy is the most important component in the treatment of borderline personality disorder and leading to large reductions in symptoms that persist over time. Many forms of psychotherapy have been developed specifically to treat the disorder. The best study are dialectical behavior therapy, mentalization-based treatment, transfer and focus psychotherapy, and systems training for emotional predictability and problem solving. So I'm going to go ahead and go through each of those in this presentation. The first one is dialectical behavior therapy. And what that is pretty much, it was actually the first psychotherapy shown to be effective, and specifically for the treatment in borderline personality disorder. It is a manualized therapy, so they combine cognitive behavior therapy with Eastern philosophy and traditions. One of the key dialects in the treatment is the balance that therapists must achieve in validating the experiences and behaviors of the patient while promoting change. This therapy actually includes weekly individual sessions and weekly life skills, group sessions that teach skills in, again, 4 domains, which is mindfulness, distress, tolerance, regulation of emotions, and interpersonal effectiveness. There's also phone consultation with a therapist and team consultation and meetings which play an important role. But this therapy actually usually just lasts and is designed to last for at least 1 year. Now, there has been several studies under this dialectical behavior therapy, and it's been replicated several times and with consistent results. So after 1 year, patients in the treatment group had at least an 80% reduction in suicide behaviors, and fewer inpatient stays were twice as likely to stay in treatment. Second treatment is mentalization-based treatment. It is actually the second psychotherapy technique developed specifically for the treatment of borderline personality disorder. It has roots in attachment theory, and its goal is to improve the patient's ability to mentalize, that is, to understand his or her own and others' mental states. This treatment uses weekly individual therapy sessions, and group sessions over at least time span of 18 months. Now, when the patients were followed up at 18 months and 8 years after treatment, retention of gains and some continued improvement were observed. So again, it's effective as the other one is as well. The next one is transference-focused psychotherapy. This one is a variant of psychodynamic psychotherapy. It lasts for at least a year with twice weekly individual therapy sessions. The primary focus is on emotions arising in the relationship with the therapist and the therapist's use of traditional psychodynamic techniques such as interpretation. There are clear limitations, clear limits, and a treatment contract that is developed at the beginning of this therapy. The last treatment I want to share about is systems training for emotional predictability and problem solving. This is a 20-week group therapy program for patients with borderline personality disorder. And it incorporates elements of cognitive behavior therapy, skills training, and systems therapy. It is also intended as an add-on treatment for patients being managed in the community. My conclusion is pretty much the treatment of borderline personality disorder is a very challenging thing. But in the past 2 decades, there has been tremendous growth in development of specialized psychotherapy treatment techniques, which is designed for this particular population. And they offer a lot of effective options that can lead to reductions in self-harm, suicide, and even hospital admissions. So, and there also have been overall improvements in symptoms associated with this disorder specifically. In general, patients with borderline personality disorder now have far more treatments options than they did 2 decades ago. And although the availability of specialized psychotherapy techniques do still remain limited. Some biblical insights. I really enjoyed these 2 verses because they came to my mind as I was doing my presentation. The first verse is Acts 20:35. It says, "In all things I've shown you that by working hard in this way, we must help the weak and remember the words of the Lord Jesus, how he himself said, it is more blessed to give than to receive." And then Matthew 7:12, "So whatever you wish that others would do to you, do also to them. This is the law and the prophets." And so, yes, I really just like these 2 verses because as counselors, we are going to be helping a lot of people who are struggling, who are weaker. and maybe dealing with a lot of issues, and just to be reminded as a Christian or as a believer, and also as a counselor, being reminded that we must work hard to help them, and that it is more blessed to give than to receive. And I think that's so key, because we're going to be giving a lot of ourselves, a lot of our emotion, a lot of our thoughts, a lot of our time, a lot of listening ears. And it can be very draining, especially through time. But just also to be reminded that we're doing what the Word has called us to do, which is to help others and to also give to others and to bless them. And whatever we do for others, may we do in such a way as if we're doing it how we would want others to treat us as well. And so, yeah, I just thought these two verses were so neat, and correlates a bit with my presentation.